this is not really research, and there's no mice or experiments or anything. This is natural human disease. So this is hard data from Europe on what's been happening with Creutzfeldt-Jakob disease. And I think I was asked to do it in relation to time as well, so over the years. So I think if this works. This is a slide based on data from the European surveillance system that's been running since '93, and all member states have been involved for various periods, mainly the larger countries really from the start. And this is just a summary to show you, in Europe, what is the types of CJD that are identified. And you see that the great majority of cases of Creutzfeldt-Jakob disease in Europe are sporadic cases of CJD. Thought to have a spontaneous onset, as John said. Variant CJD is a very small segment, but had a disproportionate effect because of all the difficulties with the occurrence of a disease that was transmitted from cattle to humans. We have a small number of iatrogenic cases of CJD, largely linked to human growth hormone treatment or Duramater grafts. And then this segment of about 10% of cases which are hereditary forms of CJD, together with Gershman-Strauss-Schenker syndrome and fatal familial insomnia. So I think this distribution of cases is more or less what you see around the world, with sporadic CJD being by far the most common form of human prion disease. This is a slide just showing what's happened with time. I don't think I've shown this before. This is from 1990 to 2013. This is UK data showing the number of cases of CJD that we have in total, which is the blue line, which, as you can see, gradually has crept upwards over the years. The yellow ones are the ones in which the neurologist usually thinks it's CJD, but they end up with a different diagnosis. And it's quite an important issue that when people are being suspected of suffering from CJD, they don't always have the condition, which makes diagnosis quite difficult and a major challenge, and we do need better diagnostic tests. The interesting thing from my point of view is, though, that this yellow bit has gradually shrunk over the years. This suggests that neurologists are getting better at diagnosing CJD and that we're getting more complete data with time. What about the actual numbers? This is deaths from sporadic CJD from 1985 to 2013. Again, you see these numbers gradually creeping up, and you see the, sorry, I'll go back again, the mortality rate, which is often said that sporadic CJD occurs at about 1 case per million per year, a very rare disease. This is 1 case per million per year, but we're clearly exceeding that in recent years. And this again suggests that we don't think there's anything going on in terms of the disease becoming more frequent in the population. I'll come back to that in a minute. What we think is that we're getting better and better at diagnosing CJD, which is a good thing for medicine, and it's a good thing for families too, because the implication of this is that in past years, a lot of patients with CJD were not being correctly diagnosed. These jumps are quite interesting. I think it's around here that we introduced the CSF 1433 test, which is useful in diagnosis. And MRI has already been introduced around here. That's not necessarily the reason for these changes, but it may have an influence. Now, as I was saying, this rise is something that's seen in many countries, and of course in the early days in the UK, some people were saying, well, the reason we're getting more and more cases of CJD is because of BSE, that in fact we're getting atypical phenotypes of sporadic CJD, and that, of course, is a worry. It still is a worry, but this is data from Australia, where the pattern is almost identical, and Australia doesn't have BSE, and probably doesn't have scrapie either. So this is a phenomenon that's been happening all over the world, the improvement in the diagnosis and recognition of CJD. The other thing that's changed is age, and this is a slide just showing the age distribution for various different periods in the United Kingdom. And this is 70 to 74, 75 to 79. And as you can see with sporadic CJD, this is a disease predominantly in middle-aged and older people like me. The other thing that's happened is that the mean age at death has gradually shifted to the right, suggesting that one other thing that's happened is that we've got better at recognizing Creutzfeldt-Jakob disease in older people, where often someone with dementia is not properly investigated, but we think that we're getting better at recognizing older people with CJD. This is iatrogenic CJD, just to remind you that this is a terrible tragedy, of course, the fact that CJD has been given to people through treatment with growth hormone or with duramater grafts. And in the UK, this outbreak continues. It's not actually disappeared as yet, although I think in other countries, human growth hormone-related CJD in particular is now almost disappeared. So just to give you an idea of what the mortality rates are of sporadic Creutzfeldt-Jakob disease in all these different countries I was mentioning, the bottom line here is, I'm terrible, I'm pressing the wrong button, is that the incidence rate overall in the UK is about 1. It's a bit higher in France, it's about 1 in Spain, it's about 1 in Germany. And the implication of this is that actually Creutzfeldt-Jakob disease occurs with the same frequency everywhere. And that's very important because it does suggest that it's unlikely to be due to some environmental infection, and it's more likely to be due to some sort of spontaneous disease. You'll notice that there are some countries with very low figures, and the reason for that is that they've just started doing surveillance. And it takes time, it takes years to establish a surveillance system so that you can identify cases efficiently. Now, this is just some individual countries just to show what's happened with time. Here we go back, I think, to 1993 to 2013. These are the absolute numbers of cases in France, Germany, Italy, Spain, and the UK in red. But of course, they have different sized populations, these countries, so if you correct for the size of population and do mortality rates, what happens then is the curves become very much closer together. And you see the same effect, is that with time, the apparent mortality rates, the apparent numbers of cases of sporadic CJD have gradually increased with time in all countries, although overall the rates are now more or less the same at about 1.5 cases per million per year. So still a very rare disease, but not as rare as we once thought, probably reflecting improved diagnosis. So that's just data about the numbers of cases. I thought I might just show some other things that can be done, because if you have a system that allows you to identify many people with CJD, or rare disease, you can find out things about the individual cases which can inform you about risk. And one of the things that often concerns people is whether there's a possibility that contact with people with CJD might present a risk to the individuals in the family, for example, who might have had contact with someone. Now, the thing I should say is that we have no evidence of that at all. We don't think that CJD is a contagious disease in the normal sense. But this issue was raised a couple of years ago when in Spain, a pathologist developed sporadic CJD, and this prompted the person who runs the Spanish surveillance system, Jesus de Pedro Cuesta, to ask us to look at the data and find out how often do we get sporadic CJD in doctors, nurses, and paramedical staff, because of course if you work in a neurology ward you inevitably come into contact with many people with CJD if you work for long enough. And so this data was analyzed, and it's not actually, this is just the numerical data, but I'll just show you a better slide, which is, this is a pie chart showing on the left the cases and on the right the controls. That is age-matched people who don't have CJD, who we also get information from. This is a way of doing research into risk. And as you can see, the proportion of individuals who are doctors or other healthcare workers is very small in sporadic CJD, and it's exactly the same as it is in people who don't have CJD. So this is additional evidence that in fact the risk from contact with patients with CJD, there is no evidence that it actually poses a risk of transmission of infection. There are special circumstances, however, in hospitals. For example, if you work in a neuropathology laboratory or you work with CNS tissues, brain tissues, that you have to take precautions. I'm not saying you don't need to take precautions, but I'm saying the evidence is that, at least for social contact, we have no evidence of transmission. Now, the other thing that is possible to do with countries working together is to do trials. And of course, trials in Creutzfeldt-Jakob disease of drug therapy are very difficult, as Professor Collins said, because the numbers are small, and there are all sorts of practical difficulties in trying to enter people with a severe disease into a drug trial. But I thought I'd just show you this from a study that was done in France and in Italy, which was to try and study whether the drug doxycycline, which has been used in individual cases of Creutzfeldt-Jakob disease, to see whether it is actually an effective treatment. And this study has been very important because A, they were able to do it with a great deal of work and effort, And they unfortunately discovered that doxycycline didn't affect the course of sporadic CJD. It didn't extend survival. But it does suggest that it is possible to do large studies provided nations work together. And I think that's a very important message. But I think the other message is this drug doesn't seem to work. We desperately need new treatments, new candidate drugs, which I think was clearly stated by John this morning. Just to show you what the data looks like for doxycycline, this is survival. I think this is similar to the curves you've seen before. This is, as in the mice, the proportion of people who are alive after with and without the treatment. You can't see it very clearly. It doesn't show. There are two lines. One is with treatment, one is without treatment, and they clearly overlap all the way down. So unfortunately, doxycycline doesn't work as a treatment with people who are clinically unwell with sporadic CJD. But of course, that doesn't answer the question as whether doxycycline might work as a preventative drug. And indeed, there's a trial in Italy going on at the moment to see whether doxycycline might help in the prevention of the symptoms of FFI. Now, I haven't said anything about variant CJD, which is, of course, the disease that caused all the political upheaval and all the great interest in the general public. But this is the data for variant CJD, which shows by year, and this is along the year, these are the years along the bottom to 2014, and this is the number of deaths in the UK and outside the UK in red. And as you can see in the UK, despite the extensive exposure of the UK population, variant CJD has virtually disappeared, which is very good news. And I think we were probably very lucky that it was difficult to infect humans orally with BSE. There is, of course, uncertainty about whether there may be further outbreaks, so it's very important to continue to carry out surveillance. And in other countries in the world, again, there has been a decline, and I think you may hear about one more recent case from Pierluigi. And of course, as I've always said with this slide, when you see this decline in the mortality of a rare disease almost to nothing, the political interest in these diseases declines and the amount of funding declines. So we're all very grateful for any source of funding that allows us to continue our work. This is BSE. This was the cattle disease, more than 180,000 clinical cases of BSE in the UK, an incredible epidemic of a neurological disease in cattle, which is zoonotic to humans. And here's the recent data on BSE from the OIE website. France, Ireland, Poland, Portugal, Spain, the UK. BSE has almost disappeared as well. And understandably, many of the measures that were introduced in Europe to try and protect people from BSE are gradually being relaxed because the disease appears to be disappearing. That doesn't mean that there aren't still public health concerns in relation to these diseases. And this is from New Hampshire, I think last year, in which a patient with Creutzfeldt Jakob disease had an operation on the brain, and the instruments were unknowingly reused on other people. And this sort of issue causes major concerns in relation to public health and major problems in relation to how to deal with individuals who've been exposed, what should they be told, what are the risks, etc. And this sort of incident, I'm afraid, still continues to happen from time to time. So I think there are still public health concerns about these diseases. I think variant CJD is in decline, but it's not yet over, and I think people shouldn't become too complacent about that. So finally, I just thought I'd show you a picture from last year. I think you might have shown it last time. We have a surveillance network that's in Europe, but also invites people from other countries around the world, and we meet once every couple of years now and exchange our experiences of CJD, and it's a very useful venue to exchange information, arrange research, discuss issues, and there's lots of people here, some of whom you may recognize, including Larry Schoenberger, just there. And it's a beautiful photograph because it was taken by Ermias Belay. Thank you very much.